In order to understand breast cancer, we have to take a closer look to the main tissues of the breast, which are the breast glands, the milk-producing glands, and the milk ducts that carry milk to the nipple. So let's look at the system, because that will explain to us why there are two different cancers, different breast cancers. Okay, the breast glands are the oldest tissue of the breast. Being the oldest tissue, remember what we just learned, originating from the mesoderm, the breast glands are controlled from the old brain, to be precise, from a specific area in the cerebellum. During the later time of evolution, the milk ducts were lined with a new cell layer, which is squamous epithelial tissue. And this new layer, this new tissue type, this new cell layer, being a younger tissue type, is controlled from the cerebral cortex, from a very specific area. So what we can conclude here is the following. As far as breast glands and the milk duct lining is concerned, that these two tissues developed at different times during evolution, they derive from different embryonic germ layers, they consist of different tissue types, they are controlled from different parts of the brain, they relate to different biological conflicts, and therefore they cause different types of breast cancer. And we're going to start with the breast glands. The conflict that is linked to the breast glands is, as Dr. Hammer calls it, a nest-worry conflict. In nature, a female can suffer such a nest-worry conflict if her offspring is all of a sudden seriously sick or injured. If this is the case, the breast glands in the female breast will instantly start to multiply and to proliferate. And the biological purpose of the cell proliferation is to allow the female to produce more milk, and provide more milk for the offspring to speed up healing. And Dr. Hammer found that we women, that our breast glands, so to speak, respond the same way when we unexpectedly worry about a loved one. When a parent, one of our children, a partner, a dear friend, a sibling is a reason of concern. And this is how this works in details. The moment this worry conflict occurs, the conflict impacts in the area of the brain, specifically in the area of the cerebellum that controls the breast glands. And at this moment, the breast gland tissue, or the breast glands, immediately start to proliferate, forming a breast gland tumor or a breast cancer in the glands. And Dr. Hammer found that even if a woman is not breastfeeding, this age-old biological program is still set into motion, because the female breast is synonymous for caring and nurturing. What we have to realize now is that during the conflict active phase, there are no symptoms. So a woman that has a glandular breast tumor that is in the active phase will detect the tumor either through breast self-examination, or it will be detected through a mammogram. In any case, conventional medicine, or another point I want to make to clarify that, the size of the tumor, so the size of the glandular breast tumor, is determined by the intensity and the duration of the conflict. In other words, the tumor is always proportional to how intense the conflict is. So the more intense the worry conflict, the faster and bigger the tumor grows. But so we have to realize again that it is, and I keep emphasizing that it is the psyche that is the driving or the leading component of the unit. So again, we cannot ask a woman not to worry. But as I said before, it is a very important step to downgrade the conflict. So to put the worry situation in perspective, to talk about it. The woman will notice she's less stressed out, she can sleep a little bit better, and she's not as preoccupied with the conflict, because that implies that now the conflict mass is less, which means the tumor is going to become smaller, because the psyche, the brain, and in this case, of course, the organ, the breast glands, always work in synchronicity. Because of the cell proliferation, conventional medicine labels such a glandular tumor as a malignant growth. But Dr. Hammer clearly shows us that there is nothing malignant about such a tumor, that this is not a malignant growth, but an age-old natural biological response, and no reason to panic. With German new medicine and with the knowledge of the 5 biological laws, my friends, cancer is no longer a mystery. A woman that has been worrying about a loved one for a longer period of time will not be surprised if she finds out that she has a breast gland tumor. She will now understand why she has the breast tumor. She will also understand why she has the tumor in the breast glands. And on top of it, she will understand why she has the breast tumor in her right or in her left breast, because we also have an answer for that. Well, Dr. Hammer found whether a woman has a tumor on the right or left breast is determined by her biological laterality. In other words, by her handedness. So this is not if a woman or if a person writes with the right or left hand. Here we're talking about the biological laterality, which is determined at the first cell divisions, at the moment of conception. The easiest way, or an easy way to determine our laterality, or to establish it, I should say, is the clapping test. So I ask you please to clap in your hands. Okay? Thank you. So the hand that is on top is the leading hand and determines or tells us if we are biologically right or left-handed. Okay? So if the right hand is on top, the person is biologically right-handed. If the left hand is on top, the person is biologically left-handed. And this is the rule. So please remember that. So where are the right-handers? Hands up. And left. Look at that. I know there's always more than we expect. Okay, so this is the rule. Please remember this now. A right-handed woman responds to a conflict with her children or her mother with the left breast, or we can say with the left side of the body. And she responds to a conflict with her partner, who is anybody who is not her mother or her children, so her friends, her siblings, even her father. Our father is our first partner, so to speak. Our friends, so everybody who is not mother or children, is on our right side. So a right-handed woman will respond to a worry conflict or a conflict in general over her partner, anybody who is not mother and children, with the left side, with the right side of the body. For left-handed, it is reverse. So for left-handed, the right side is the mother-child side, and the left side is the partner side. So why is it this way? Well, a right-handed woman like me, I would carry my child on the right side, on the left side, so my right hand is free to do things, to operate, to work and do things. So my mind, let's call it my biological mind, associates the left side with my child. And Dr. Hammer found that this also applies to us right-handers, to our mother, and that the right side is our partner side. So this translates, as far as breast cancer is concerned, to the following. If a right-handed woman develops a breast cancer in her left breast, that indicates that she suffered or is still suffering, if it's still conflict active, a conflict or worry conflict in regards to her child. Okay, the child is sick, is in trouble, son is taking drugs, daughter get divorced with all sorts of trouble. So this would be on this side, mother is ill and so forth. But we want to keep one thing in mind. This does not say that if we are worried that we get a cancer. Okay? It's the other way around. When a woman has a glandular breast cancer, then we know that she suffered or is still suffering a worry conflict, and that the worry conflict is the underlying cause of the conflict. So we always start with the symptoms, because the symptom indicates what is happening on the emotional and psychological level. Okay? So the good news is, with this wonderful new medicine, is that a woman not only knows now, you women here, not after an hour and a half, we learn that we now understand why a woman gets breast cancer to begin with, why the breast cancer is in the breast glands, and why the breast cancer is in the right or left side, right or left breast. But a woman that knows German New Medicine will also prepared for the healing symptoms. And that is, of course, most important, because this is when we see symptoms, typically. As we learned in the conflict active phase, there are no symptoms whatsoever. There's no pain, there's no nothing. It's just the woman might detect this, as I said, through self-examination and so forth. Well, we want to understand the following. It is the psyche where cancer, or breast cancer specifically here, originates. So it is the psyche where cancer originates. So it is in the psyche where cancer begins to heal. So let's see what happens during the healing phase. As we have learned with the fourth biological law, the moment the conflict is resolved, if the woman carries tubercular bacteria, then the tumor will be broken down and decomposed. Okay? So that is, I like to call it a construction site. There is a lot of decomposing and breaking down the tumor cells, causing potentially discharge, and this discharge can penetrate the skin. It is a foul-smelling discharge. It is literally a decomposing process. And this foul-smelling discharge can penetrate the skin, and if a woman is not prepared for that, it might scare her. But if she knows Dr. Hammer's work in German New Medicine, she will understand that this is a positive sign that the tumor is now in the healing process and is being naturally removed. She will also realize, as I explained, when such a tumor is broken down, there could be blood in the discharge. Of course, I always emphasize blood loss has to be watched, but blood in the discharge is nothing to be scared about per se. It is part of what is going on in the breast as far as healing is concerned. The woman will not be surprised that she has night sweats. Such a decomposing and healing process of the glands, of the breast gland tumor, can take 4 to 6 months, okay, depending on the size of the tumor. So a woman who knows Dr. Hammer's work will be prepared that this might take a little while, a few months even potentially, and she will not get scared. She will be mentally prepared and ready for that. She will understand that the night sweats are part of that healing process as an indication that the TB bacteria are doing a great job. One thing that is most significant, and this, my friends, applies to all tumors that grow or better, that are decomposed during the healing phase. So breast gland tumor, colon tumor, liver tumor, lung tumor, prostate, uterus tumor, and so forth. When the tubercular bacteria are breaking down the tumor, they produce a lot of tubercular secretion. This is what has to be expelled, right? In this case, through the breast, through the skin. So they produce a lot of tubercular secretion. And tubercular secretion is very rich in protein, which is now eliminated. So it is essential to supplement the protein loss, because protein deficiency can cause serious complications. So we have to supplement the protein loss through a protein-rich food. Essential in order to support healing, because we have, cancer patients that are on raw food diets, on juice diets, and all these things, and they get weaker and weaker and weaker, and the main reason is because they're missing proteins. So for us, when you have your night sweats, even if it's just one night, if it's 2 nights, make sure you get your proteins, because that gives us energy. And in a case when there is a big tumor that has to be decomposed, if this takes months, this protein supplementation is essential to make it successfully through the healing phase. As we also learned, healing always takes place in a fluid environment, so there will be a lot of swelling in the breast, it will be very painful. Okay, on top of it, the woman is very tired, which is significant. She has to be tired, because this is not the time to jump around and do crazy things. This is the time to lie down and rest as much as possible, so we can support the body and doing that important healing process. So that's why there's little energy. So we need to give the body as much as energy as possible. This puts a little question marks behind cleansing, right? Cleansing can be very demanding on the body, so we have to look exactly what we're doing here, because if a woman in this case, goes through an intense healing phase and the cleansing is wiping her out, this is definitely counterproductive. So the point is to give the body energy, 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 good food, healthy food, organic food, right? We need to feed the body specifically with proteins in order to support that healing process. And of course, there's also mental support. There is emotional support. So this is when we all have to help out. So if we have a loved one who is going through a healing phase, through any healing phase, in this case we're talking about breast gland tumor healing, we have to support the loved one. And so it is good when the whole pack, as I like to call it, when the whole family and the friends learn this great work, so we can support each other, right? And encourage the person doing that healing process. And this is also the work of the German New Medicine practitioner. The German New Medicine practitioner provides an environment free of fear and panic. He or she is supporting the patient, the client, during the healing phase on the physical level if necessary, because healing is already running its own course, but support the client and the patient emotionally and mentally, okay? Because, as Dr. Hammer points out so well, the biggest complication for any healing phase and every cancer healing phase is fear and panic. Because with fear and panic, we had a presentation last few months ago at the planetarium about abandonment and existence conflict. So fear and panic causes water retention, right? And the water, usually the retained water, goes into the healing organ, and this causes more pain and more swelling. So fear and panic is physically and mentally difficult. So, and Dr. Hammer's beautiful work gives us that gift that we do no longer have to fear cancer. Okay, so we can prevent also further shocks. Well, we know this already, just to summarize it here. If the woman does not have the tubercular bacteria available or the fungi to remove the tumor will encapsulate and the tumor stays in place. So there is no night sweats, there is no inflammation, there's nothing, the tumor stays there. Okay? And as I said before, such an encapsulated tumor can be found years or decades later with a mammogram. You hit 50 and then you get a letter from the provincial whatever, and they tell you have to take a mammogram, and boom, there's a cancer diagnosis of an encapsulated tumor that has been there for years. Okay? So it is important to understand all this, to have this information before we have any symptoms. And this does not only relate to breast cancer, because we know how to take it. Okay? And a woman can live with such an encapsulated tumor for the rest of her life. Women cannot die of breast cancer. What should a woman die of? The extra cells? No, they don't kill. Okay? It's the fear, it's the panic, it's other conflict shocks that are added that involve vital organs, ducts can occlude, bile ducts with an anger conflict and so forth. Okay? All right, we go a little bit further. Because what happens, I go back for a second, if the healing phase becomes chronic, in other words, the woman has the TB bacteria, but the healing goes on and on and on and on. Of course, the tumor needs a certain time to be removed and decomposed, but this can take longer than it usually should. And the reason is the following. In order to understand why a condition, this in general, and of course of breast cancer particularly tonight, we have to understand what we call in German new medicine tracks. So conflict, relapses, triggers, and tracks. Sounds like a good movie title. Okay, so what happens here? The moment we have such an unexpected conflict shock, our mind is highly alert. And highly alert, our mind picks up all the components that surround the conflict, like the location where the conflict takes place, the people involved, sounds, anything that our mind associates or finds significant in association with this conflict situation. Right? And this, we call in new medicine these components that come basically with the conflict shock, we call them tracks, because we can say, like train tracks, we can say that the biological programs runs on tracks established at the moment of the DHS. So it runs on these tracks. But the biological purpose of the tracks is there's a reason for that. The biological purpose of the tracks is to be a warning signal, an alarm signal, saying last time you were at this location, last time you saw this person, last time you went by this hospital, last time you saw this type of car, you had a conflict, so watch out and stay away. So if a person is in the healing phase and all of a sudden sets on one of these tracks, the conflict relapses, and this is and is reactivated, and this is the conflict relapse that interrupts the healing phase and therefore also prolongs it. Right? And we call this situation, when a healing literally hangs here, we call this as I said, hanging healing situation. And this is the reason for chronic conditions or reoccurring symptoms, including reoccurring cancers. So in the case of a glandular breast cancer that is in healing with all the pus and discharge and the decomposing process, every time the woman sets on a track because the worry conflict is reactivated or any other trigger, then this will go on and on and on. So it is important to be aware of what is happening here. In German new medicine, it is essential to identify these tracks so that the healing phase can be finally complete. So what we also have to realize, and this is significant, that any supportive treatment on the organ level can only be successful if we also heal or complete the healing process emotionally and psychologically, because it is the psyche that is the driving component of the unit. So any treatment on the organ level can only be supportive to ease the pain, to slow down, if you want, an intensive healing process, but it is us, it is our mind, it is us, up to us and our work, so to speak, to complete the healing parallel, of course, also on the psychological level. Otherwise it goes on and on and on. But the fact is, my friend, in regards to, let's say, glandular breast cancer, even if the healing phase takes longer, right? It is essential that the woman knows that this is not a malignant disease, that this is not going to kill her. It just takes longer. Of course, it's draining on the system, but it is the attitude and the understanding that this is a healing process. It's like we have a wound and we always, injure it or scratch it and, oh my God, it's bleeding again. It's going to take 3 days longer. Okay? This is exactly the same thing. It just takes longer. But we, in this case, because we're talking biological conflicts and not an accident or anything, we have to work on it on the emotional level to complete the healing. Okay, we're doing well. Okay, we learned now the biological program of the breast glands. So let's look now at the lining of the milk ducts. We have learned breast gland cancer controlled from the cerebellum, linked to a nest-worry conflict, the lining of the milk ducts, ectodermal tissue controlled from the cortex, and a different tissue type, a different biological conflict, and therefore a different type of breast cancer. Okay, so let's look at the conflict. The conflict that is linked to the lining of the milk ducts is, as Dr. Hammer calls it, a separation conflict. In this case, if that happens in nature, in this situation, a female is not worried about an offspring. In this case, there was a separation from the offspring because the baby, the offspring, is lost or had been killed. If this is the case, the lining of the milk ducts instantly starts to ulcerate, causing tissue loss. And the biological purpose of the ulceration in the milk ducts is to widen the ducts so that the milk that is no longer used can drain off easier, which prevents congestion of milk in the breast. We see again a very significant reason why there is tissue loss, just like we have learned with the cervix. And Dr. Hammer found that we women, or our breast, responds the same way if we experience, or if we have a conflict that a child, our mother, a partner, a spouse, a sibling, a dear friend was torn from our breast. So the biological, psychological feeling behind this, I can no longer nurture you, I can no longer care for you, you're torn off my breast, and the program runs its course. So how does it work? The moment the conflict occurs, the conflict impacts now in the area of the brain that controls the lining of the milk ducts, and the program is switched on. And during the conflict active phase, as we already learned, there is ulceration, so tissue loss in the milk duct lining. During the conflict active phase, when that occurs, a woman might not even notice it. If it's more intense, she might notice some pulling in the breast. However, if the conflict active phase is very intense and lasts over a long time, this ulcerated area, because of the tissue loss, there's tissue loss in the lining, so the tissue might contract. Okay, it's pulls together, it contracts, forming what is called serous knots. But conventional medicine diagnoses this as a cancer, although it's not even a tumor, although it's not even cell proliferation that is happening here. It is tissue loss, and the tissue pulls together, forming that knot. And the serous knots are treated, quote unquote, with mastectomy. So here's a screenshot from the website of the amputation of the cancered and serous breast. So we have to keep this in mind, what is happening here. And this is even more disturbing when we see what happens in the healing phase, when we see what happens when we allow the breast to heal. Well, when the conflict, the separation conflict is resolved, the ulceration process stops. And the ulcerated area, so the tissue loss, is now refilled and replenished with new cells, with squamous epithelial cells. And it is the cell proliferation that occurs during the first phase of healing that is diagnosed as an intraductal breast cancer. So an intraductal breast cancer, my friends, is a curative breast cancer. It is a healing tumor as opposed to the glandular tumor that grows and develops during the conflict active phase as a result of a worry conflict decomposed in the healing phase. In this situation, in this case, the tumor is an event that occurs in the healing phase by refilling and replenishing the tissue loss that occurred during the conflict active phase. So a curative tumor. Typical symptoms, as we learned, there is swelling. It's a very good picture. There is swelling in the breast because healing always occurs in a fluid environment. So there is swelling that can cause a considerable amount of pain. We are in vagotonia. The woman is in vagotonia, in the warm phase. So the breast is hot, is red, and also can be itchy. So all these are positive signs that a natural healing process is going on. Conventional medicine, because of the cell proliferation, labels this tumor as malignant. But we see that this is not malignant, that nature is doing a very good job here. But we have a lot more things to say. The majority of breast cancers are in fact intraductal breast cancers linked to a separation conflict. And this should not surprise us why the majority of breast cancers are intraductal. It should not surprise us where breast cancer is, on the rise. When we look at the divorce rate, when we see what is going on out there, second family, third family, another divorce, and other separation. Separation conflicts, of course, can be caused by the death of a loved one, but also the fear of a separation, the fear of losing a loved one is already a reason why the program is switched on. And please, I'd like to emphasize again, it is a subjective event, okay? So not every divorce, not every loss of a loved one, not every argument that causes a fear of separation causes a breast cancer. We have to look at it from the other way around. If a woman has an intraductal breast cancer, then we know that this is a healing phase, that she is in the healing process of a separation conflict that has been resolved, and that the tumor is now a healing tumor. And that's why we often see intraductal breast cancer when women come to terms naturally with the separation, when they found, let's say, a new partner, or when the separation, the unexpected separation, let's say, even grieving period is over, when couples reconcile, you say, right? Yeah, reconcile, sorry. Right? So this is when we can basically analyze this and say, well, it's good news, this is a healing process, the woman came to terms with that separation. Okay? Laterality, of course, has to be taken into account. So the good news is now we are in control of the situation. So a woman that finds out that she has a intraductal breast cancer, a right-handed woman, let's say in her right breast, right? She will know exactly why she has it. Because she realized, well, a year ago, 2 years ago, a few months ago, I had this breakup. I went through this separation with a partner, with a dear friend. My best friend moved away and she told me out of the blue, situations like that. And she goes into healing and she will realize what caused the cancer and that she is now in good shape, that she is in the healing process. Again, the healing phase can be difficult, it can cause pain, it can go on for a long time, but the point is, and the good message is, a woman can never ever die of an intraductal cancer. This is not a vital organ. There is not the heart or the bronchial tubes involved that can occlude. Right? It's painful, it's difficult, but it can cause death, really. Okay? Of course, tracks have to be watched, okay? Because it is the tracks again, seeing the egg spouse going to the place, another relapse of the separation issue, and then the healing phase is prolonged. So again, important to identify the tracks. It is not difficult to identify the tracks because we know now what conflict is behind that, and the moment we set on the track, we have cold hands. Okay? So when we look for the tracks, we just always ask, okay, observe your daily routines and what you do during the day, and when you get emotional and when things sort of come back emotionally, and when we are on the track, we get the cold hands, and then we know that's the track. And now we have to find ways and strategies to neutralize them, and that's work, but it's good work because it's the first step to complete the healing process. Naturally, such milk ducts are narrow, so they can easily cause, the tumor can easily cause inflammation in the breast, and this is then called an inflammatory breast cancer. According to conventional medicine, one of the most aggressive and most deadly. Well, all it is really is that there's inflammation in the breast, now treated as one of the most aggressive cancers. Okay. Let's keep going. So we learned now that the intraductal breast cancer develops during the phase A of healing, right? This is where the swelling is, there's the edema and the water. This is in phase A. And during the epicrisis, remember what we learned? There's this sudden stress push that that presses the edema out. So there is the water in the breast is pressed out, followed by the urinary phase. And after the epicrisis, the tumor slowly degrades. And some of you might have read those studies, right? The study from Norway, some breast cancers may clear up without treatment. Well, my friends, Dr. Hammer has been talking about this for over 20 years. Right? So we understand now what that implies. It means they clear up without treatment because it's already in healing anyhow, and it goes into this phase, into phase B. Okay? What happens in phase B? Well, as soon as the water is pressed out here, during the epicrisis, the tumor, as we just learned, slowly degrades and calcifies. So during phase B, we see microcalcification. On a mammogram, this microcalcification is visible as white specks. But hold on to your hats, because conventional medicine diagnoses these white specks as a cancer. New York Times, June 22nd, 2004. The diagnosis of ductal carcinoma in situ, a non-invasive lesion of the lining of the milk ducts, has increased markedly in recent years. As a result of the widespread use of mammography. In 1983, the condition was diagnosed in 4,800 women. 2 decades later, the number has soared to more than 50,000, with the vast majority of the lesions detected as microcalcifications on mammograms. And how is the microcalcification treated? With mastectomy. Okay? Mastectomy is an effective treatment for a widespread or malignant appearing microcalcification throughout the breast. My ladies, we have to be on top of this. Okay? We see what's out there, and we have to protect ourselves. With German New Medicine, my friends, the mutilation of women and the war on cancer with chemical and radioactive weapon is over. So why, we might ask, is Dr. Hammer's work not taught in medical schools? Why are not patients all over the world treated based on his discoveries? Why is this not common knowledge? Well, I'd like to give you a little bit of a background information. In 1981, Dr. Hammer submitted his findings, his discoveries, to the University of Tübingen as a postdoctoral thesis. But in spite of its legal obligation, the University of Tübingen and the medical faculty of Tübingen refuses to this day to evaluate Dr. Hammer's discoveries. So in 1986, Dr. Hammer took the medical faculty and the University of Tübingen to court. And in court, the judge asked the dean of the medical faculty why they don't test Dr. Hammer's discoveries. And this is what the dean said: "We don't want to know whether Hammer is right." Shortly after, Dr. Hammer was stripped of his medical license on the grounds that he did not revoke his discoveries. In other words, Dr. Hammer lost his medical license, although his discoveries have never been disproved. To this day, Dr. Hammer has been persecuted, and all his wonderful discoveries, this valuable knowledge, has been systematically suppressed by the authorities. Millions of lives could have been saved over the last 23 years, including lives of our loved ones. And this is how Dr. Hammer puts it: "We are fighting a crime committed on patients all over the world." So now we're going to talk about metastasis. Okay? And we're going to start with the same slide we started out with, which shows so beautifully Dr. Hammer's discovery of the correlation between the psyche, the brain, and the organ. Remember what we learned? Each cancer is controlled from a very specific area in the brain, linked to a very specific conflict that correlates biologically to the same conflict, that area of the brain that controls the cancer. Well, what does the metastasis theory say? According to the metastasis theory, a cancer, so a primary cancer, let's say in the breast, breaks away from the tumor and spreads via the lymph system or the bloodstream to other parts of the body where it causes a new growth. Well, let's take a closer look, and let's first of all just use or ask some common sense question. Well, if it were true that cancer spreads through the bloodstream, then we would have there would be a serious risk of contracting cancers by coming in contact with blood of a cancer patient. Okay? So we would also have to ask the question why donated blood is not screened for cancer cells. So we should ask the authorities the question why donated blood is not being screened. Also, if it is true that cancer cells travel or migrate via the bloodstream to other parts of the body, why is then cancer of the blood vessel, so to speak, not the most common cancer? Because on the journey to other parts of the body, such a cancer cell can get easily stuck at the wall of such an artery or a vein, or a blood vessel, I should say, and can cause a cancer there. And also, if it were true that cancer cells travel via the bloodstream, why is there no such thing as a cancer of the heart that is supplied with the biggest blood vessel, which is the coronary artery? Well, let's look at the lymph system argument here. Well, there's also a problem because there are quite a few tissues in our body that are not supplied with lymph fluid. For example, the bones. And bone cancer is the most most frequent secondary cancer. So the question is, how do the cancer cells get there if there is no lymph fluid? Also, there is the argument or the of so-called brain tumors. So in other words, that there is a cancer cell that migrates to the brain, causing a brain tumor. But we have to keep in mind that we are equipped, so to speak, with the blood-brain barrier. You know what that is? The blood-brain barrier is a filter, a selective filter, that makes sure that no harmful substances can get into the brain. So you can imagine, if we have this protective filter that does not allow harmful substances to pass that barrier, why should cancer cells be allowed to do that? There's also another important argument. We never hear about brain tumor cells or brain cancer metastasizing to the body, right? We never hear about that. Based on the conventional medicine theory, this would translate into brain cells that should then be found in the breast, in the prostate, in the testicles, in the cervix, in the colon. Unheard of. Well, what we understand, of course, is that based on Dr. Hammer's discovery, secondary cancers are not caused by migrating cancer cells, but that secondary cancers are caused by further or secondary conflict shocks. Because we learned about the system here, and that each cancer is controlled from a very specific area in the brain. So under no circumstances can a cancer spread to a part of the body that is controlled from a completely different part of the brain. So and let's look at this with a couple of examples, okay, from what we have learned. We've learned that the intraductal breast cancer is the healing phase of a separation conflict. The lining of the milk ducts consists of squamous epithelial tissue, originates from the ectodermal germ layer, and is controlled from the cerebrum. A lung cancer, on the other hand, is a conflict-active phase, or the lung cancer, I should say, develops during the conflict-active phase. The lungs are endodermal tissue, they are adenocells, and they are controlled from a very specific area in the brainstem. And the conflict linked to the lung cancer is, as we learn, a death-fright conflict. So what is happening is the following. The moment a woman gets a breast cancer diagnosis, and she has a death-fright conflict because she associates the cancer with a death sentence, it will impact in the area of the brain that controls the lungs, and then she develops lung cancer. So the time lapse between the diagnosis of the primary tumor and further tests is crucial, because it is during that time that the tumor grows. Okay? So routinely, when a person has cancer, any type of cancer, the person is sent for lung x-rays, right? And this is then, if the person had a death threat, when they find a lung cancer, and then they're saying that the cancer is metastasizing. But the cancer is not metastasizing and says, well, I think I'm going to go to the lungs, or maybe I go somewhere else. I mean, this is obviously a new shock, and a cancer that is controlled from an entirely different part of the brain. It's a different tissue, and it is a different phase. And the same applies to bone cancer. Okay? Bone cancer is the most frequent secondary cancer after lung cancer. So let's see what happens. The bones are controlled from the cerebral medulla, up here, from the cerebral medulla. They are of mesodermal origin. And the conflict is a self-devaluation conflict. So you can imagine, if a woman gets a breast cancer diagnosis, she can truly have a self-devaluation conflict. A self-devaluation conflict means now I'm useless at this site, at this area. So that's why I put this picture here. Just the image, the idea of a mastectomy, the fear of a mastectomy can cause such a self-devaluation conflict, and the program is switched on. And during the conflict active phase, we have the tissue loss during the active phase causing bone cancer. Bone cancer, my friends, is by definition tissue loss. In other words, holes and gaps in the bone. And Dr. Hammer often shares this with us, that when he was a medical student, he had a hard time with this because he said, we always learned that a cancer is a growth. But in the case of bone cancer, all of a sudden it's not a growth, but it is a hole. It is a tissue loss. It is gaps and holes in the bones. So this would translate into the following scenario, and just follow the logic. This would translate into following, that a breast gland cells breaks away from the milk ducts, migrates all the way to the bone, and causes in the bone a hole. This is the logic. But what we also understand here, and we see that why this metastasis theory has so many contradictions and there's so many unanswered questions. But what we also understand is the following, that again, routinely, the woman is sent, in this case, the breast cancer patient, is sent for lung x-ray and for bone tests, right? And the bone cancer is typically found in the sternum or in the ribs, in the area where there is potentially, where there is the tumor, because this is where the self-devaluation conflict runs its course, and this is why they find the bone cancer in this area of the brain, of the bone. With German new medicine, all these conflict shocks, these diagnosis shocks, these secondary cancers of these types can be prevented because a woman understands why she has a breast cancer, she understands why it's in the ducts, she understands why it's in the glands, she understands why it's the right or left breast, she knows when it's active, she knows what it's healing. My friends, what are we going to do? Well, first of all, we have to stop walking. We have to stop walking. And we have to educate ourselves. And we have to liberate ourselves from this kind of control. And with German new medicine, we are in control. We can live without a fear of cancer. Or to say it metaphorically, with German new medicine and Dr. Hammer's great gift to us, we can reclaim the daffodils and the color pink. Thank you.